We go from one difficult topic to the next, gun violence. And I'll begin with a question. When traditional criminal justice institutions fail, who picks up the slack? In the case of gun violence that has ravaged cities across the country and frustrated law enforcement authorities, unique partnerships involving community advocates and public health authorities are increasingly filling the void. Chip Brownlee, a correspondent for The Trace, has outlined this growing phenomenon with a weighty goal: enlist and train local residents to serve as neighborhood interveners to prevent deadly conflict and retaliation on the street. Central to the effort in New Orleans is Ernest Johnson, here to my right, co-founder of Ubuntu Village, which has launched a program with the local health department and local hospital that is already beginning to take shape in the city. Similar versions of the program have been launched in other communities, but I'll let Chip and Ernest discuss how it came to be here and how it is designed to work. Please welcome Chip and Ernest.
Good morning, everybody. Thank you for being here on I think this is the last day. I hope you had fun last night in New Orleans. And thanks for getting up this morning. Ernest and I are going to have a conversation, but before we do that, I just wanted to kind of set the stage a little bit and talk a little bit about gun violence nationwide. So I work at The Trace. I'm a reporter at The Trace. I've been covering gun violence there for almost 4 years. I started in 2020. I cover mostly data and federal policy, but I also write a newsletter called The Trajectory, which focuses on the people, the policies, programs, like Ernest, that are trying to prevent gun violence across the country. So before we get into our conversation, let's see if we can get this to work. Every year, at least for the past couple of years, there have been more than 48,000 gun deaths every year. That is an astronomical figure. 2021 was a record year for gun deaths. This is a number that includes both homicides and suicides. We can get into that a little bit more. I think many of you probably know that the vast majority of gun deaths in the country are suicides, but a big bulk of them are homicides. A major barrier to understanding the issue of gun violence in America is misinformation, lack of data, lack of understanding about how the issue works, what the underlying issues are there that affect the crisis. That's kind of what we do at The Trace. We focus solely on the issue of gun violence. We try to expose it through a variety of different lenses. I wanted to start, though, with a couple of just myths and realities before we get into the conversation. I think there's a lot of misunderstanding about how gun laws in America work, how the issue affects people. The first one up here, the myth is background checks are conducted with all gun sales. That is not true. Nearly a quarter of guns in the US are sold without a background check. The next one, you see it on TV all the time, like when you're watching crime shows, on the major networks, and people talk about, he had an unregistered handgun. In most of the country, there's no such thing as handgun registration. Only 4 states and DC have registration requirements. And so when you see things like that, he was carrying an unregistered handgun, that's not illegal. And there's really not, in most places, a method to go through to register a handgun. This is something that has changed quite a lot in the last few years, that you have to prove that you can shoot a gun, that you've had training before you can carry it in public. Only 16 states require people to get training to carry a gun. Not the vast majority, but the majority of states now, you don't even need a permit or a license at all to carry a gun. I'm sure many of you are from states that have probably recently passed permitless carry laws. These are those laws that allow people to carry guns without any additional background check or training requirements. All they have to do is carry it and, basically be an adult. And that's totally legal. And then the last myth is that background checks catch all dangerous behavior. That is also not true. The way that background checks work in this country is that they look through criminal history and some mental health records and a couple of other things, but there's no extensive background check requirement that goes through and looks at, someone's social media history, whether they've had any contacts with extremists or extremist organizations. And it also doesn't capture criminal charges that didn't result in a conviction. And here's a map that we did at the Trace that is about the permitless carry states. And then here are a couple more laws that people think we have, but we don't. One is a handgun ban for people under 21. Under federal law, you're actually only required to for a federally licensed dealer, they're only required not to sell to people under 21. So if it is a private sale, for example, with a seller who's not a federally licensed gun dealer, they don't have to go through that process. They can sell to anyone who's over 18. And in fact, in a lot of states, that 18 requirement is also not true. That's a federal requirement, but some states have different rules. For long guns, the age is 18, so if you're a federal firearms licensee, the age that you can sell to is 18. So, and then for possession, it's even lower for that, so you could be 14, 15 in most states in the country, and on a long gun like a rifle or a shotgun. And digital crime gun tracing, you also see this a lot on TV where the police and the crime shows on TV will be like, oh, let's throw the gun into this tracing system that we have. There's all these digital records. We can see exactly where the gun came from. It's also not how that functions. There's actually a federal law that bans the digitization of gun records. So when a local police department finds a crime gun, they put in a request to the ATF. The ATF has to go through all this paperwork to find the guns and eventually trace it through these paper records, essentially, and get it back to the last legal owner. But they can't always get back to the original owner or where it came from. So the crime gun tracing is also not how it works on a lot of TV shows. Couple more slides before we get into the conversation. Another barrier that we have is a lack of data. We don't know how many guns are sold in the U.S. each year. We don't know exactly how many guns people in this country own. We don't know in exact numbers how many people are even wounded or injured by firearms every year. There's not a reliable national incidents of violent crime, so a lot of the FBI crime data is incomplete. Many states and local cities don't report that data to the FBI. That's changing a little bit now. It's getting a little bit better, but there's not a kind of a comprehensive nationwide view of violent crime. And then, like we were talking about with the crime gun tracing, we don't know all of a gun's previous owners. We do have some estimates. This is a chart that we did as part of our gun sales tracker. We use background checks data to look and see about how many guns are sold every year. So you see in 2020, there's that big spike towards the right of the graph. Gun sales went up drastically in 2020. That corresponded at the same time with quite a significant spike in gun violence. This is another estimate that we put together using Bureau of Alcohol, Tobacco, Firearms, and Explosives data that looks at exactly how many guns are in the U.S. We tracked it through manufacturing reports, imports, and exports, and we put this together. We think we're the first ones to actually put together an estimate that relies on actual manufacturing and imports data. You can see that we're nearing 500 million guns that have been produced for the US market. This goes back to 1899. There's issues there with attrition and how many guns fall out of circulation every year, but that's one of the best estimates that we have. A couple other things. Most Americans don't own guns. This is a survey results from Gallup that looked at, how many homes in the US that have firearms. The last time they did it was in October, and they found that 42% of respondents said that they had a gun in the home. Another 2% had it somewhere else, but the majority of homes did not have firearms in it. This is another one from the RAND Corporation that uses a similar, they use surveys, they use local and county reports from things like concealed carry licenses and other things like that to put in an estimate, and they found that about 32% of households in the US have a gun in the home. And there's obviously some states like Montana, Wyoming, a lot of the mountain states that have much higher firearm ownership. And this is where I want to get into kind of some of the way that we in the media cover gun violence. A lot of times, I don't think this is necessarily true with a lot of the local stations, but at least when you look at national media, anytime there's coverage of gun violence, it's almost always about mass shootings. That's not to say that mass shootings aren't, terrible, awful, terrifying, and ruining a lot of people's lives, but the vast majority of shootings in America are not mass shootings. And when I'm talking about mass shootings here, I'm talking about incidents in which 4 or more people are shot, not necessarily killed. So you see different definitions of mass shootings out there. This is the one that we use. It comes from the Gun Violence Archive. This is a chart showing the growth of mass shootings. And then in 2023, there were more than 700 people killed in these mass shootings. But then when you look at the totality of people that are shot and killed in the US each year, that's only about 3% of the more than 18,000 gun homicides last year. We talked about earlier about the suicides being the vast majority of gun deaths. This is a chart that tracks that over time since the 1990s. You can see that it went down in the 2000s, but has been going back up. And then the same for gun homicides. When you see the coverage of gun violence, often it is focused on cities, it's focused on inner cities. That's not necessarily accurate. Of course, that is often what's covered, but gun homicides don't just happen in cities. They happen all across the country. This is a chart from the CDC that shows that, in fact, the majority of the counties in the US that have the highest incident of gun homicide are rural counties. So the top one you can see there is Lowndes County, Alabama. That's not too far from, I grew up in Pickens County, Alabama, but that's not too far from there. And then many of these on here are not metro areas. You see a few on there that are metro counties, but the majority of them are rural or suburban counties. 100 to 300 people are shot each day and survive. We know pretty well how many people die from gun violence, but it's a lot harder to track how many people are shot and injured. So now that we've kind of set the stage with the issue, some of the data, I do want to turn now and chat with Ernest a little bit about what's going on here in New Orleans. Earlier this year, I saw this story about how New Orleans had gone a week without any shootings, which is a good thing for New Orleans, but also kind of rare. Not just rare for New Orleans, but rare for a lot of places around the country. But it was part of this broader trend of declining gun violence from the pandemic. So we saw homicides and shootings go up quite significantly during 2021 from 2020 into 2021, and then even more into 2022 before they started coming down at the end of that year and going into last year. And if you look at the cities across the country, there's been about a 12% decline in gun homicide last year. And in New Orleans, the decline was even more significant. It was something like 30% last year, which the last time I looked, I think that was through the middle of December was the last time that they reported that data. And I was curious, like, what was going on? All the time we, report about the bad things that come with gun violence, the increases, but very rarely do we look at what's causing the declines. And so I wanted to know what was going on in New Orleans, so I reached out to Ernest, who runs Ubuntu Village, which does a lot of things, and I want to let you talk about that because I don't think I can explain everything that you do. It's so much, but the things that I noticed was that they were working on a street outreach violence prevention program and a hospital-based violence prevention program, which have been popping up all across the country as a way to try to address gun violence without, relying solely on law enforcement. They had gotten a grant to do this work in New Orleans, and so I wanted to reach out and see how that was kind of corresponding, if at all, with the decline in gun violence here. Ernest, if you are able, can you kind of just tell everybody what Ubuntu Village is and what the work that you do?
Yes, thanks for having me. Ubuntu Village NOLA is a nonprofit organization that primarily works with young people and their families who are impacted by the criminal justice system. Because of our track record in the community, we was invited to become a partner of the health department here in New Orleans, with the understanding that the integration between the criminal justice systems and violence have essential common themes, right, that bring young people in, to the criminal justice system. So with that, we partner with the health department here in New Orleans, and our goal is to look at the data, because from what we have found, even though the decline, there aren't a lot of indicators to say why it went down, right? We are looking at, got some research now and looking at some summer jobs, because we increased a lot of summer jobs this past year, and looking to see if that had a role. And there's some indicators that's saying yes, because of the getting young people jobs through the summer, it was an opportunity for those to not be involved in criminal behavior. One thing we notice also is that there's a lot of misperception, in particular with the community, when we talk about violence, right, in our community. And too often, even from a media perspective, there's this black and white line, right? Because a lot of times here in New Orleans, if it's someone who may be of influence, the media tends to bump the coverage up, right, and cover it a whole lot. But every day there are young black boys getting killed in the city, and they don't get that kind of coverage. You hear it one time and then it disappears. So what we're doing as we start this, we're being very intentional about the communities we work in, and we have identified what you might call hotspots, right? And being very intentional in going door to door, block to block, and trying to do a front door service and meet those needs and get their input, right, about what they feel like they need for their community. And there's a lot of information that a lot of people know, but we believe that if you don't involve the community in what you're doing, then you're just spinning your wheels, right? You have to really have them involved in it in a way and build trust, because here in New Orleans, we've had the program before. And because of a number of reasons, the program was dismantled. So there's a lot of distrust. So we are trying to build that trust back up and start the program over again.
I want to go back just a little bit. Maybe, I don't know if everyone is familiar with what community violence prevention and intervention is. Can you just kind of tell everybody from a high level kind of what CVI is, and then on a day-to-day what it looks like? What are you doing when you're going out and you're trying to find people to work with?
So we identified, like I said, we have specific communities because the team is so small now. But what we're looking for is high-risk individuals who may have been involved in violence before. We're looking at maybe victims of violence who have been shot or have went through the hospital. And that's one of the great things we have, like with the hospital, they easily can give us referrals, right, from the hospital when victims come there. And then there's conflict mediation, right? But conflict mediation, it worked pretty good, I think, a few years ago. But the people that we are seeing now that are involved in crime, they are no nonsense, right? So trying to mediate that now is one, building that trust with them, right? And getting them involved and understanding the underlying root causes, right? So our daily thing is doing outreach in that community, right? Getting to know the people in the community, addressing their root causes, right? We know economic issues can bubble up into violence, right? When you put people who live in poverty in certain situations, it tends to bubble up violence. So we're trying to address that in a real-time way so that even like people from the hospital, right? When we have referrals, we don't want them referrals to now you have to go through all these channels to get what you need. We want warm handoffs, right? So that when people come through that, we can support them in a way that they get the things they need underlining what is happening in their community.
Mm-hmm. This is all, I think this has kind of changed in the past few years, but a lot of the responses to gun violence, especially when it spikes, are, let's hire more police officers, let's try to target gun trafficking, let's do all these other things. In the last few years, there's been this shift kind of maybe not enough, but to these community-based approaches. What you're trying to do is essentially find a way to make communities safer and stronger without having to rely solely on the police. Would you say that that's?
That is true. We just had a conversation, our district attorney is doing a program here also, and we had the conversation that you're putting the guys that work for us at risk, right? When the police are going in there, when the district attorney is going in there, that you are definitely putting those guys at risk because they can be labeled as a snitch, right? Or you calling the police on. So we'll be having conversation with them. But as far as the investment, we have seen over and over, we have done a lot of investment in police and law enforcement, right? And it doesn't get us the results that we all want to have, right? So if we can, I would say if we can invest 25%, or 50% what you invest in law enforcement, I think you can see an immediate impact in our communities. And one of the other things we're addressing too is like the psychological part, right? Some of the communities that we're working in is dense, right? No lights, right? Blight, all these other issues that psychologically, I think it makes people feel like we have no work, right, when we live in these type of communities. So how do we address that at the same time and say these people are just as important as everybody else?
Mm-hmm. Can you talk a bit about how did you go from the work that you were doing to getting involved with the health department partnership and getting that funding? What was that process like? I think that could be something that we in the media could do a better job in covering. Is the community groups that are out there doing this work often have a lot of, at least the ones that I've talked to, have trouble going through those processes. There's a lot of red tape, there's bureaucracy. I don't know if that was your experience when we talked last. We talked a little bit about that, but I think there's opportunities to talk about like the path that that the government is setting up for community groups to do this work. Is it difficult? Are there roadblocks? What does that look like for you?
I think when you're dealing with government or any per se systemic institutions, it always becomes sort of complicated, right? So we're being very intentional, right, about what we're doing and not trying to just sort of put a Band-Aid on it, right? Yeah. In this process with the hospital, I will say we have a great champion in Dr. Vegno, who runs the health department. And so it's been a great champion for our organization. But the transition was, when they came to us and gave us the opportunity, we pondered on it whether or not we should take it. But dealing with the juvenile justice system here in New Orleans, it's always like you're responding to something after it happened, right? You're caught up in the criminal justice system, the families are there, now we're responding to try to support them to get them out of. And that's a hard fix in a lot of situations, right? We thought it would make more sense, being we have the relationship with the juvenile justice system, to do more prevention work, right? And because at the end of the day, whether it's a fatal shooting or just a shooting, we all lose, right? We don't win, per se, when someone's getting shot or murdered. So that's what made us jump to it. And the transition has been smooth. And again, I would always say, we're trying to be very intentional and not have an illusion that we're going to save the world tomorrow with this program, right? And trying to build some sustainability, right? Because it's government programs, right? Government programs come in for a few years, give you a little money, you think you're doing something, and then something else becomes sexy, right? And it shifts, right? So we're trying to build some sustainability outside of what we're doing with the government.
You were talking about the shift that happened in New Orleans, right? There was, and still, I think technically is, an Office of Gun Violence Prevention, and it was doing work and kind of.
Yeah, so the Office of Gun Violence now, it was under the city government, now it's under the hospital. Mm-hmm. And we're a part of an ecosystem that there's the trauma center inside of the hospital. There's also violence interruptions team inside of the hospital. And we are the community team. So, and there's a lot of other teams that's part of it, around domestic violence, you know, child abuse, you know, anything that has anything to do with violence is trying to be integrated in this ecosystem that we're building. Mm-hmm.
Where are you kind of at in the process of your street outreach program?
We just done some of our first hires. We've been doing some community walks. We've been putting signage down that says violence is a health crisis. And just trying to get people engaged again, you know, get them awoke, if you want to say again, about the issue, because there tends to be a numbness in this city around violence, right? We see it all the time, and people just go about their business like it's nothing happening, unless it impact you immediately, right? And one of the things is that if we're deeming this as a health crisis, then how do we get folks involved, right? Like, we've seen some crises, right? And it wasn't the crisis that we have seen in this country, the response was tremendous about different issues. So if we can start to get people engaged around this health crisis, right? There are a lot of reports that say it's a health crisis. If we can get folks to start looking at it that way, right? Then I think we can do a better job as a society of moving it forward.
Do you think that's starting to happen?
Well, if I'm involved, I believe it's happening, right? I'm not going to be involved in nothing. I don't feel like nothing is happening, right? So I believe it's happening, you know, and I tell even some of the doctors I work with, right? You know, and they be going through all the trajectories and language barriers and stuff like that. And I say, you just got to believe in what you're doing, right? Sometimes it don't always take you to push the needle a little farther, right? You just, if you believe it, you got a plan, just follow through with it and see what happens, right? And don't get off don't change the lanes in the plan because unless necessary, right? But let's just believe. So I think it is happening. Yeah, we got a lot of responses. A lot of people is interested in what we're doing. As in any other city, I think there are multifacets that everybody believes that they're the experts. Mm-hmm. So we just kind of stay in our lane, right, and do what we do, right, and not try to cause any enemies, per se, in this fight against crime, and believing that we need everybody. It's not a one-sided thing, that we need everyone involved that wants to be involved to curb violence here in New Orleans.
When we first talked, you were telling me about, I think, how you had visited, you went to Nebraska, was that right?
Yeah.
So can you talk a bit about what that process was? Because you looked outside of New Orleans at other places in the country before you decided how your program was going to work, right?
Right. So we visit, a team of us visit Omaha, Nebraska, and it's a group called 360 Omaha that has a collaborative that addresses all the issues specifically in the communities. and they have a community, violence program. When we looked at it, we said, well, this is awesome, right? But we realized the demographic was totally different from New Orleans. So how do we sort of support that or utilize that program here in New Orleans? And what we found, we had all the pieces we needed in New Orleans, right? And I will add that from a cultural perspective, here in New Orleans, it's one of our most essential tools, right, that we can use because everybody likes the culture. We're embarking on Mardi Gras, and for the most part, we have Mardi Gras season and social and pleasure clubs that hit the streets every Sunday without any problems. Hundreds and thousands of people on the street enjoying themselves, right? So I always tell people, we can use this blueprint, right, to care about each other, right, and take care of each other. And that way, we don't have no violence. So there's always a sense of joy in New Orleans, and the culture is what brings it, right? So we lean on that a lot, too.
Mm-hmm. I think that when I look at when I've talked to different people who are running these CVI programs across the country, they're all a little bit different. Some of them kind of follow the same models. But they're all different because everything is so local. You have to listen to the community that you're working with, right? The people that you're trying to reach to make the program function in a way that'll reach them. Can you talk a bit about how you're finding the young people that you're trying to work with and how you reach them?
Yeah, so again, we have a great relationship with all the stakeholders here, I would say, with the sheriff department, with the juvenile justice system, and the adult system to some degree. So we have relationships. New Orleans is a very small city, so you got to be careful who you curse out, right? Because you might know somebody, it might be killing somebody down the line. So it's easy to build a relationship here. And what we're doing, we're rekindling some of the relationships that we didn't have, and we're building a relationship with the understanding that it's a health crisis. And a lot of times they talk about the data, and in most black communities, they tend to ignore the data because the impact that it has on a family member, if it's one family member, they don't care about the 30 or 40 that has happened before them. They're talking about their family. So how do we begin to heal in our community about these events? So, like I said, we grinding in, talking to the community, making ourselves available, talking to them, and getting to know people. And for the most part, it's easy to get to know people in New Orleans, right? Especially like from the cultural barriers and some of the systemic stakeholders. We got a pretty good relationship with folks.
Have you thought about how you're going to measure the success of the program?
Yes, we are in partnership with Vera Institution, Tulane Institution that are walking with us every step of this, right? Like the surveys that we're doing in the community, the places that we're visiting, they're walking step by step with us. So they're gonna as we go through the program, they're gonna be getting the data right and seeing where it makes sense at. Even if we have to pivot, they will allow us to pivot, right, in a way that we can track this not only for the public, but for other reasons like grant purpose and the grant itself to track.
Yeah, I feel like that's really important. There's not a ton of research out there on gun violence prevention, especially these programs like yours that have been around for a long time but are really getting more federal funding now. So there's more funding coming in to kind of evaluate them, but there's not a lot of like published research out there. And that can be, a difficult thing for, I think that it works. People see that it works, but I think it's helpful to have the research to back it up too.
Yeah.
When you've been doing this work for a long time, I want to talk a little bit about the way that the media covers gun violence. What do you see as some of the pitfalls in some of the coverage that you've seen?
I think the media, there's a saying, I don't know if it's still, if it bleed, they want to cover it, right? Mm-hmm. but I don't think it has the storyline of empathy and compassion in it in most of the stories. As I indicated earlier, there have been several high-profile cases here that involve white people. They will run the story for 2 or 3 weeks until they get the suspect. But yet, a young black man can get killed, and they'll cover it, and you won't hear anything else about it. So I think it's lopsided, right? And even when you're reporting crime, I don't think, and I guess it's a news reporter job to just do that. I think sometimes, personally, I'm asking too much for you to go into details about what may have happened, what is the history of it, right? Because even in the criminal justice system, when some of these cases have came out, there's a lot of underlying root causes that promoted this, or we could have prevented as a society if we would have just paid attention to some of these kids. But that gets ignored, right? So it's just about what happened that day, who's responsible for it, and then people are left numb. And I've had several people talk to me about, I wish they just stopped talking about we ain't had a murder in a week. Because as soon as they say that, you got 3 or 4 that happen, right? Right after, they say, oh, they ain't had, and then 3 or 4 happen. And we're not thinking about those individual families, right? We're just thinking about the sensation of reporting in the way that we reported. So, I don't know, I think sometimes, I tell people all the time that we have to create our own narrative and hope that we get reporters like yourself to put it out there, right? To give another side of the story, right? That's what I would encourage, that if you're writing, right, in some essence, go against the grain, right? Reporting I guess an innovative, unique way, right? Test the waters, right? To write different, right? Don't be traditional like most writers write, right? And when you're talking about stories, and I think it's always good to, in black communities, when this is happening, we lose all around the board, whether it's the victim or the perpetrator, right? So how do we write that in a way that is not harming people? It's not just, it's just not like the knife is going deeper inside of someone when you're writing these stories. And I don't think reporters think of that. I think they just catch the story, write it, and on to the next story.
I think some of that comes from relying so much on law enforcement narratives and listening to what the police are saying in a press release, or what the prosecutors are saying. And I think that contributes to kind of this binary between like a victim and a perpetrator, that those 2 categories are always distinct and separate. But if you have an opportunity to report a bit about what the root causes of gun violence are, marginalization, poverty, lack of resources, over-policing in some circumstances, when you can report on those things, you kind of expose the fact that a lot of accused perpetrators, suspects, have also been victims in some ways. What do you think about that? About how can the media do better at covering the root causes of gun violence instead of just the day-to-day outcomes?
Yeah, I think, I don't know if that fit in a story of someone, getting shot on that particular day, but I think there should be space that if you're writing, at some point you take some time out to write some of this stuff about some of the underlying root cause as a reporter, right? So if I'm looking at you and say, Chip always writing about the murders, then I think it kind of traumatized us as a community. But if you're writing in some parts about, these are the root causes, right? These are some of the underlying issues around violence, right? And getting people to understand that, because I feel like in New Orleans, people is just numb about some of the data, because it just repeatedly happen, and they never talk about why it's happening or how it's happening and who's contributing to some of the stuff that's happening.
Yeah, absolutely. I think we're going to take a couple questions now.
I think this is a good time to dive in for a few questions. And if you could stand and say your width.
Rick Erbach, WGNO News. Ernest, the question for you, you mentioned light. I'll also toss in missing street signs. So,
Tell me about it.
this is low-hanging fruit. Yet, in the same time period, though, we continue to elect the same city officials year after year. They have task forces that have task forces. How do we get around that and actually address the problem of, you go to the Woodland Bridge, half the lights are out right now. You go to 610, all the lights are out right now. If we can't get the low-hanging fruit, how are we going to solve the crime problem?
Right. So I live in New Orleans East, so I experience that every time I'm going home at night, right? It's just dark. And I will tell you, I'm far removed as much as possible from the political arena because it's just too much, right? Is that I feel like I'd rather be with the low-hanging fruit and the people who are doing some of the things opposed to dealing a lot with the political establishments that we've had in this city, right? Because it's just been sort of far as the community, and I think that depends on who you're talking to, right? Because some people have benefit, but we've been, in the same place. It's like sometimes people refer to it as being a foreign country right here in New Orleans about some of the issues. So that's what we're talking about. We're trying to address the blight, right? The lights. And a lot of the stuff comes from out of New Orleans East. So psychological, if you just seen it dense and dark like that, I mean, what you expect, right? So I agree with you. We are trying to address that, and that's why I think we're so excited in some aspect, is that we're working with the health department, which is an entity of the city, but it's Dr. Vigno, and she's brilliant in what she's doing, opposed to City Hall.
We have a question back here.
Hello, I'm Leslie Vire with KBAK, KBFX over in Bakersfield, California. One of the things you mentioned was looking into the root causes of shootings and kind of going beyond just what local law enforcement says. Over in Kern County, we have a pretty prominent issue with gang violence that police usually tell us is the root cause of a lot of the gun violence that goes on. So as a local reporter, how can we go beyond what law enforcement is telling us, especially when they hold some information so close to the vest when it deals with things like gang violence?
I think when some of these programs started, they were directly addressing gang violence, right? Because they felt like if they can get to the leader, that they can change the trajectory. I find that to be the same today. I think if you begin to get to know some of those folks in that community and put a twist on it, right? Just put any kind of, it don't have to be nothing big, right? Because you want to be careful with it. But I think if you can put a positive twist on them as a gang, right? Because what I found with a lot of young men in talking to them, is a lot of peer pressure, right? They're just involved and a lot of them really want to get out of the gang, right? But because of those issues, so I think if you start putting a positive twist on the stories, right? I think you can embody something different opposed to with the police, because the police are only going to tell you so much. They'll tell you half of the story most of the time because of the evidence and what's at stake.
I would also question what they mean when they say gang. So in New York City, for example, there's something called the gang database that the NYPD runs, which has been the subject of a lot of controversy because it has literally tens of thousands of people on it, and the police department will add people to that database over nothing really more than a social media post, and there's no way to get off of that list. And then when they have a shooting, if they find that a person involved in that shooting, whether they're a victim, the person who was shot, or the person who did the shooting, if either one of them were somehow on that list, then they will classify that as a gang shooting or say that it's gang related. And then you look at that list and sometimes it's like 14, 15-year-olds who were like posting on Instagram about how they had a beef with each other, and there was nothing in there specific about an organized gang or even like a crew or something like that. And I would just, kind of question what their definitions are in some of those circumstances, because and a lot of times the gangs are not like these organized criminal enterprises. I'm not an expert in this, but from the people that I talk to who work in this place, in these type of issues, the gangs are usually very loosely organized. They're really just more like groups of friends who get in beefs with one another, and it's not like this, organization that you see like in the movies. I would just question some of that too.
Question.
Okay. Chris Joseph with Fox 8 here in the city. I suppose I have two questions. The first refers to some of your comments earlier. Admittedly, I've been wondering this myself. Obviously, the data shows that crime has been reduced significantly in the city in recent months. I'm wondering if you could speak a little bit more about what you found in that regard. And second, as that data shows, crime is decreasing. And we discussed a little bit about how perception can be reality. How do you balance reporting on crime to the point where maybe it's too much? If reporting on crime creates a perception that there is crime, but crime is actually decreasing, how would you navigate that, I suppose?
I think it's important to give people a snapshot of if crime is actually declining. But I also think that you have to find a way to, I guess, deem it, to kill a misperception about it in a way that gives people, I guess, some kind of hope or to get them engaged in a way to help support preventing crime, right? Whether it's, there's a lot of fear-mongering in the news, and it tends to carry over in communities to have everybody either holding their purse too tight or crossing the street and walking another way. So I think if there's a way to talk about some of the issues in a way that brings the perceptions to people's mind to decrease crime, at the same time giving a snapshot of the data, but not so overwhelming. Like, I get data statistics weekly, right, about the crime, right? And it's just disturbing when I know someone who's been murdered, right? So how do you navigate? That's the best scenario I think I can give you on that, about how you navigate that.
Ashley Hamilton with WGNO. Here in New Orleans, as you know, when we come out in different communities, they're like, oh, you're only here to report the bad stuff. So as someone that walks around in the community, how can we as reporters let the community know that we are there to help, rather than, I feel like sometimes they see us as the police, like, oh, we don't want to talk to you because you're only here for bad news, but when I'm giving you my card, I want you to call me when the good news happens too. So how do we get back in the community where they actually trust us?
So that's all. People, between, I don't think you're at the level of police, and I think New Orleans is really friendly. So I would say, I think you can get in a community, and I think it would do a ton of good if you was just reporting about some, minor things, highlighting how young people impact, because in essence, juveniles in this city get a bad rap, right? There's a small percentage of arrests and young people who are involved in the criminal justice system. But because of the fear-mongering and because of a couple of incidents, it's on a high level that all the juveniles are doing something, right? So I think that's one place you can start, is reporting some of the things about what young black people are doing. And not to dismiss any other race, right? Because I think violence impact everybody, right? So, and even some of the white communities, just to have them to start talking about some of these issues also, right? So we're in partnership with Trinity Church, one of the Episcopal Church, right? It's a white man church. So we talk to them a lot about restorative practices and issues like that to get them involved, to be talking about not only their kids, but kids that they may encounter with. So I would say, every opportunity you get, you report it. But tell me, even if I was giving you all the scenarios or opportunity to report something, will you be able to report it? Is there something that says, well, this is hot today, I can't report this? Or because we've reached out to some news reporters about issues, right? And if it's not a hot topic, or it don't feel like it fit on their table, then they just ignore us, right? So how do we navigate getting the stories to you all in a way that you can report it? Because a lot of times we get ignored when we're talking about these issues.
Next question here.
Emily Goodell, Apple Valley News Now in Yakima, Washington. I wanted to ask you, are there any examples you can think of way that we can provide context in our reporting that's appropriate for sort of maybe not the immediate breaking news situation, but as we're reporting throughout the day? Because one of the troubles I run into is sometimes I feel like trying to add in context or statistics or trying to put the issue, compare it to other situations. Sometimes I feel in the moment like that might come off as disrespectful or trying to minimize what's happened in a particular case. So is there a good balance of how to say, well, crime is going down even though we just had this murder happen today?
Right, all right, yeah, I think in the context of crime going down, but not to just make that crime is going down to stick, right? It's like, you don't want that just to stick. I think you should have something behind it or before it, right, that speaks to either the issue or to humanity in general, right? I think when we talk about the embodiment of individuals, I think it resonates with everybody. So how do I say something, or how do I report something that embodies every individual who's watching this, that relates to this story that you're bringing on the news?
I think we have time for one more.
Hi, I'm Kat Stromquist with Gulf States Newsroom. We're public radio in Louisiana, Mississippi, and Alabama. I'm based here in New Orleans. I'm so curious about community violence interruption. Can you talk a little bit about, when your team is having those conversations, either in hospital rooms or in the field, what is said? Like, what is the messaging there that, is going to get through to folks and maybe, stop that cycle either of retaliatory violence or, what? Because I think we all agree, violence bad, but, what are some of the kinds of things that you think really communicate to, folks that make a difference in those moments?
Yeah, I think one of the things is addressing the harm, right? So it's a healing process when an individual has been harmed by gun violence. So through the Trauma Center, we're trying to address the harm that has been done, right? And get people to realize that, retaliation doesn't really resolve the issue, right? So that's the first thing we're doing. And then one of the other things we're doing is that trying to understand the community they live in and what might have promoted it, right? Because a lot of times, per se, it's not really a big matter. It's just a reaction of some of the issues and access to guns. But really getting into the root cause and saying, if you stay in a community that's blighted, or don't have, or where you're working at, what's the economic status of your family and the community you stay in, and trying to address those issues at the same time really looking at it from a trauma-informed perspective, right, and saying, look, there needs to be some healing here, right? If there's no healing, beefs can go on for 10, 15 years, right? And addressing like high-risk individuals, right, and saying, look, this is not going to resolve it. And the response in some cases are great. In some cases, it's just a no nonsense. They don't want to talk. But being empathetic about those individuals and really being cautious about what you say to them. Allow enough time for you to listen to them, right? So you can address them in a way that makes sense.
As always, there are more questions than time. But please join me in thanking Ernest and Chip for